You're listening to the myPET podcast, the show for pet lovers of Australia and around the world.
Hi, you're listening to the myPET podcast. I'm Aria, and as always, I am joined by our resident vet, Dr. Glenn.
Hello.
This is just general advice, but for advice specific to your dog's needs, have a chat to your vet. But we're going to hopefully give you some pointers in the right direction if you have a dog with itchy skin.
Itchy and scratchy.
Yeah. This is, a guarantee we're going to be itchy by the end of this. Being itchy is like the worst thing in the whole world.
Talking about it makes you itchy, yes.
Yes.
Yep. Just imagine how your dog feels.
Exactly.
Yeah.
So it may seem like itchy skin is obvious, but it's not always obvious, is it?
Not really.
So what signs do you look out for to see if a dog is itchy?
The most obvious and widespread sign is scratching, the old dog scratch thing. That's certainly itchy. And then, what's normal itchy and what's not normal itchy?
Yeah.
A dog scratching once, that's normal. To me, if there's red skin, if they're losing hair, that's sign of abnormal amount of scratching. The redness of the skin is nearly always there if they're itchy, but not always, but nearly always. And that can be, if you've got a dog with hair, obviously you've got to part the hair and have a look against the flow of the hair and see, is the skin red in patches. Sometimes they're red all over.
Yeah.
And there's specific spots, as in down between the pads.
Paw pads.
Paw pads,
Yeah.
Up on the inside of the legs, armpits, groin, undercarriage, and in the ears. That's sort of the most common spots.
Yeah.
That sort of itchiness starts often.
Yeah.
And again, depends on the cause of it as to, there's some local distribution of itchiness that can help you sort of pinpoint what may or may not be going on.
Yeah.
Basically, certainly redness, usually. Obviously, physically scratching, licking and chewing. A lot of people don't sort of associate with being itchy sometimes. And again, licking their feet once, it doesn't mean that they've got necessarily an itchy foot problem. But if they're doing more than just the normal clean-up after they come inside and go to bed and lick their paws for 30 seconds to a minute and then stop, that's probably normal. But if you're noticing your pet licking its feet multiple times a day, or if they're getting staining of the hair on light-coloured feet on dogs, that's itchiness.
And shaking the head with
shaking
itchy
the head with itchy ears. Yeah, absolutely.
So there are an overwhelming amount of things that can cause itchy skin.
Yep.
To really know what causes it, I will always say to people, you need to go to a vet.
Basically. It's because getting a diagnosis is really important because there's so many lotions and potions and treatments and a lot of those things are very beneficial for the specific diagnosis.
Yeah.
But I see lots of pets that owners tried this and tried that and tried this and tried that, and a week, a month, a year, 5 years later, it hasn't worked. So then they're at the vet.
Yeah.
Getting a diagnosis is very important.
Yeah.
Or at least doing something specifically about the problem and stopping it.
Yeah.
And because it could be just a one-off exposure to something, but if your pet's itchy and it's worrying the pet enough that it's worrying you, or it's worrying the pet a fair bit.
Yes.
So doing something that actually stops it from itching there and then as soon as possible, before they set up, trauma to the skin, chronic infection and all sorts of stuff.
Yeah.
Just get a diagnosis about what's going on or get a treatment for it, and then go from there.
1 second, my head's itchy. There is a lot that you can do once you know what's going on, but you really have to know what's going on first.
Yeah.
Yeah.
And lots of things are non-specific for most itchy dogs, and some things are obviously treating specific conditions about what's going on.
Yeah.
Yeah.
Once you have a diagnosis from your vet, there is a huge range of things from shampoos, lotions, potions, supplements.
Yep.
So what kind of treatments are out there? And I guess also what are the different causes? Maybe we should get into that first. Obviously you can't really diagnose it yourself, but to have an idea of what can cause it can be useful.
Yeah, absolutely. So, I mean, broadly speaking, I mean, parasites are thankfully a less common cause than they used to be because there's so many good parasite controls out there. I mean, fleas in particular are the main thing that causes itchiness, but I mean, there's still, sarcoptic mange and dermatitis mange and, follicle mites and that sort of thing. They are still out there and they can still cause problems. And if your dog's got fleas, it's going to be itchy.
Yes.
So, I mean, parasites in general can cause troubles. You can have allergies to parasites, which complicates things further, as in flea allergy, dermatitis. And that's not just controlling the fleas, there's other things to be done as well. But basically parasites, allergies are the most common cause of itchiness in dogs by far, and there can be multiple different types of allergies, as in there's certainly contact allergy, so direct contact with the thing that the pet's allergic to, and that causes a reaction at the site where the contact happens. There is atopic dermatitis, which is inhaled allergen, so the pet's breathing in the things that they're allergic to and it's coming out and exhibiting as a skin condition, so they're inhaling all sorts of things. When you start actually testing for blood allergy or skin testing where you can see how big a lump the pet gets by injecting 128 different things underneath the skin to get a diagnosis on what they're reacting to. But when they're inhaling it, it comes out as a skin problem. So that isn't anything necessarily in your yard. That could be a tree that's growing 150 kilometres away that your pet's having a reaction to. So that's one of the main types. So you've got the contact allergy, atopic dermatitis, and then basically food allergy is the other main grouping. And food allergy is not that common. I think it's a lot less common than most people think. That's causing an issue. There's certainly diets and supplements that can improve skin function and skin health, but there's not many pets that are actually food allergic. And food allergy, there's no way to test for food allergy other than a restrictive diet to exclude that protein essentially from the diet. Lots of people think that dogs are allergic to preservatives and to grains and all sorts of stuff, but essentially it's protein and a specific protein that pets are allergic to. So they eat the food that's got either beef or pork or lamb or chicken or whatever the protein is, or multiple proteins that they're sensitive to, and again it comes out as a skin condition. But some diets can help that out as far as higher in omega-3 oils and factors that make the skin behave better and work better. But if that diet has still got beef, if you're allergic to beef in it, okay, you're still going to have an itchy dog. And grain gets vilified a lot, and I'm not a huge fan of carbohydrate-based diets in general for my pets, but grain on its own, it's very unlikely your pet's allergic to grain, but potentially a grain-based diet may increase inflammatory regulators and stuff like that, so maybe it's not the greatest diet for pets that have got itchy skin. But replacing it with legumes or peas or lupins or something else isn't necessarily the best thing either. But it gets complicated.
It does. We will go into prevention a little bit later on. As far as the different causes go, I mean, allergies is a topic on its own. It's pretty massive, and that's why I guess another reason it's really important to have a vet look at it.
And get a diagnosis. Because I mean, a lot of allergic dogs get secondary bacterial and fungal skin infections, and look, I mean, ringworm happens, like that's a specific fungal infection that can cause itchiness, but most skin infections are secondary to allergic troubles, but sometimes you've got rid of the allergy and then you've got a secondary infection. If you haven't got rid of the infection, well then it's the bacteria that's causing the problem, or it's the malassezia, like a yeast infection, that's causing the problem. So again, getting a diagnosis, and that's in saying getting a diagnosis isn't necessarily that easy. So, I mean, excluding bacterial infections, excluding fungal infections, that's doable in a vet clinic situation, like as in a consultation. Parasites, okay, you can see fleas, you can detect fleas, you can detect microscopic parasites through skin
Yeah.
scrapes and that sort of thing, and that's the only way to diagnose them. So again, really important to get a diagnosis.
Yeah.
An allergy, to diagnose an allergy gets complicated. Your vet can treat an allergy without necessarily knowing what
it
the
is.
allergy is. So
Okay.
you can go down the treatment path and stop an allergy from causing problems, without knowing specifically what the diagnosis of how many things that they're allergic to.
Yeah.
But to treat that allergy in the long term, often diagnostic testing for atopic dermatitis and skin testing and blood testing, comes into it.
Yeah.
But if you present your dog to your vet and they exclude the other things, they can certainly make that dog less itchy within 24 hours using prescription medications that treats allergies non-specifically. So you don't have to do the whole hog, all at once.
Yeah.
You can make your pet a lot more comfortable very quickly
Yeah.
by excluding other things and getting a diagnosis and treating it appropriately.
Yeah, cool. You briefly mentioned secondary fungal and bacterial infections, but they can be a primary cause as well.
Correct.
Yeah.
Yep.
So things like hot spots and, like you said, ringworm
Yep.
and skin yeast infections.
Yep.
And
So they can certainly occur on their own. Hotspots, again, we see them more in dogs with allergic troubles. Ringworm, it's usually a infection on its own. Yeast infections, again, more likely in dogs with complicated allergic dermatitis stuff.
Yeah.
They just get, if the skin is hot and red already from the allergy, you get an overgrowth of bugs.
Yes.
Classic one with dogs with itchy ears, they get recurrent ear infections.
Yeah.
It's the allergy that's causing the redness in the first place, and they get an overgrowth of their normal bugs. They're not getting an infection from somewhere.
Yeah.
It's their own bacteria, it's their own yeast that's in excess growth because it's a hot, moist, humid environment for them to grow in. So, again, that's where when you get down to treatment, okay, it's treating the problem, but then it's treating the other symptoms that go along with it,
Yes.
which is, it's not a scattergun approach, but there's usually not one thing that fixes stuff.
Yeah.
But throwing 50 different things at them at once doesn't make any sense either.
No, that's right. So what treatment options are out there? For example, if parasites are causing the problem, what does the treatment options for that?
Fleas, no brainer. You've got very good flea controls, long-acting flea controls these days that kills those. Other parasites like your little mange mites and sarcoptic mites, again, long-acting medications that often kill fleas and ticks at the same time. We've got really good drugs that easily kill those now.
Yeah.
20 years ago we were giving monthly heartworm prevention at 4 times the monthly dose daily for 6 to 8 weeks to kill Demodex mites.
Wow.
And using off-label horse ivermectin injections and all sorts of stuff. But now we've just got a registered medication that kills fleas and ticks that also kills these mites.
Yeah.
Parasites, for that reason, have become a lot less common. Like, 20 years ago I used to see a flea allergy dermatitis dog twice a day.
Yeah, okay.
Now I might go 4 months between seeing one, or longer.
And it's something that most people are on top of anyway, so which is fantastic.
Yep.
Prevention is better than cure, right?
Absolutely.
But then when it comes to allergies, obviously the treatment for that is complex, as you were mentioning before. And then with you, bacterial and fungal infections, that can be part of that. But there's heaps of treatments out there for those things, whether they're separate or together, right?
That's right. So, allergies-wise, again, getting a diagnosis and your vet will guide you through that as far as, there is diagnostic tests like blood tests for allergies and skin injections where you inject stuff under the skin and get a diagnosis. There's some relatively new prescription medications that we use that aren't cortisone. Everything that was itchy used to get cortisone thrown at it and used to work, but cortisone's got lots of potentially nasty long-term and short-term side effects. There's oral prescription medications and like injections that last for a month, if used in the right circumstance, can really make a big difference for controlling the itchiness and controlling the actual allergic symptoms. But then non-specific things for allergies, things like omega-3 oil supplements in their diets, topical omega-3 oils to improve the barrier effect of the coat. If you've got a contact dermatitis dog, using things like Alavine shampoo or other colloidal oatmeal shampoos that, again, hydrate the skin and protect that barrier effect, because any inflamed skin is damaged skin, and if you've got a contact dermatitis, the more damaged the skin is, the more little microscopic bits get through the skin and contribute to keep causing those problems.
Correct me if I'm wrong, but that is why it's sort of, you really need to know what you're dealing with first, because if you go and throw antifungal shampoo at a bacterial infection, you could potentially just be like damaging the skin more.
Well, yeah, I mean, and there's, I mean, shampoos have got better and you know, medicated shampoos. I mean, there's medicated shampoos and then shampoos that specifically kill Malassezia yeast or bacterial infection or both. But is that the problem in the first place? Which is why, again, going back to a diagnosis in the first place, because there's literally 15 different shampoos that you could use. That some of them kill bacteria, some of them kill yeast, some of them kill both, some of them don't kill any bacteria or yeast at all, but are generally soothing in effect and improving the barrier. Well, if you've got a yeast infection and you're improving the barrier, it's not going to fix it. There's lots of very good topical treatments for various indications, but you've got to know which one. And by the time you cycle through 15 different, I'll try this one and I'll try this one, you're weeks or months down the track, your dog's still being itchy and you still haven't treated the problem.
So what can people do to prevent these things from becoming a problem in the first place?
I mean, good parasite control, a good healthy diet, a pet that's healthy, immune system wise comes down to nutrition and genetics and good luck basically. So you've got control over its environment and its nutrition essentially. But when you've got a specific problem, I mean, genetics is a really big problem these days as far as, there's definitely breeds that are significantly predisposed to atopic dermatitis and unfortunately some of the more popular breeds these days are very prone. So, dermatologists are loving it but hating it, as in they've got lots of work to do because of, bulldogs and Frenchies. They're very popular dogs, but half of them get atopic dermatitis and need prescription medications for the rest of their life.
I suffered with itchy skin myself, and I had a blood test, and I'm allergic to dogs.
Bugger.
I know, but didn't stop me, obviously.
No. And some things you just can't do anything about, as in, if you're allergic to blue couch and buffalo couch and lawn grasses and casuarina trees or something, I mean, you can't stop exposure to that, but that's where getting a diagnosis and, there's desensitising vaccinations and, there is treatments available.
Another thing you've sort of mentioned a couple of times is the barrier of the skin. And omega oils. So what kind of diets are good for improving that, and how does that work?
I mean, there's specific diets. You can get prescription diets that have got higher levels of omega-3 oils and other factors that help skin health in general. And then there's the specific diets as far as the excluding the protein diets. And they're not the same diets. Or you can fortify or add omega-3 oil supplements to your pet's diet, just have an anti-inflammatory effect, which is pretty much what omega-3 oils do in the right ratios. So again, it's non-specific, but it can help with an anti-inflammatory effect, which will only be beneficial.
And is there as far as shampooing and brushing and that sort of thing goes, is that part of a prevention routine?
Look, to me, if you've got a dog with a specific skin condition, yes, there's probably going to be topical shampoos and conditioners that you can use to help that specific condition. I'm not convinced that a dog that doesn't have skin problems probably needs bathing very often at all, unless they're getting dirty and you need it to keep the couch clean, etc. But if you've got a specific condition, there's certainly beneficial medications topically, as in shampoos and conditioners that you can use that definitely help out. And that's always a part of our treatment for specific conditions. But it's not going to do any harm using a colloidal oatmeal shampoo with some aloe vera in it as a shampoo for your general use. It's not going to do any harm, but it's not necessarily going to stop all conditions and problems, obviously.
And with long-haired dogs and double-coated, thick, long-haired dogs, grooming sort of is part of preventing that, because the more the hair's matted, then stuff can just grow under there.
Matted hair, and also depending on the environment. I mean, dogs don't sweat, but if they get wet, any moisture at the skin level makes them more likely to get overgrowths of bacteria and yeast. And if they've got a small problem, it's more likely to become a big problem if they're got a lot of scurf building up at the skin level, and they've got coat that should have been stripped out 3 months ago building up there. It definitely doesn't help.
Yeah. And like you say, if they're getting grubby and going and swimming in the creek and getting covered in mud and sitting around in that for hours, like my dog may or may not do.
Yeah, that's not going to help. And duck diving in dams and stuff, and getting wet ears. I mean, water in your ear shouldn't cause problems, but if you've got a little bit of a problem and then you've got water in there as well, okay, that's not going to help.
Yeah. Cool.
So regular ear cleaning and drying and that sort of thing. If you're a dog or swimmer, that all makes sense. But it's not going to cure everything.
Yeah. I think the bottom line is that skin conditions are pretty complex things to deal with. It is far over my head. And if a client ever asks me, I'm like,
and you can't tell.
You can't.
I mean, I can do lots of tests and it's still difficult to track down what's going on.
Yeah.
But you can rule out the really easy, important things, with a single consultation, basically.
Yeah.
And usually get a long way down the path of knowing what's going on.
That's it.
Yep.
And to a more comfy and less itchy pup.
Absolutely.
Which is what we want at the end of the day. No one wants to be itchy.
No.
Cool.
And they can sleep at night and so can you.
Yes, that's right. Wonderful. Well, thank you for that.
Yep.
I don't feel as itchy as I thought I was going to.
Good.
What about you?
I'm fine.
Okay, good. That's good. We don't need to go to the vet then.
No, all good.
Thanks, guys.
Thank you.